After DIEP Flap reconstruction with breast cancer surgery or any other abdominal surgery, it's likely that your core muscles will be tight and weak. Our core helps us maintain good posture and also provides stability around our lower back, so it's important to keep those muscles strong to prevent any further complications and low back pain. My name is Barfin. I'm an oncology physical therapist, and in this video I will show you some safe exercises you can do after your surgery to gain your core strength back. After your surgery, you can almost immediately start walking and going up and down the stairs, sometimes on the same day or sometimes the day after your surgery. And typically you should be able to start doing low-level exercises like the ones that I will show you in this video a few weeks after your surgery or after your drains are removed. However, consult with your doctor first, as everyone's recovery journey is different. And when it comes to more vigorous exercises like yoga, Pilates, and weight training, typically you should be able to start doing them 12 weeks after your surgery. If you had a DIEP Flap reconstruction, it's also important to do shoulder exercises to maintain your flexibility and range of motion. So if you want to see what safe upper body exercises you can do, you can click the link above. Other than that, if you're ready, let's start with the first exercise. With this first exercise, the goal is to activate our TA muscle, which stands for transversus abdominis, and it is our main core stabilizer. And after any abdominal surgery, it can actually become weak or completely shut off because of swelling and or scar tissue formation. So with this, I actually want you to feel the muscle so you're able to tell if you are activating the muscle and if you are doing the exercise correctly. So we're gonna take two fingers and find our hip bones or pelvic bones, which for me is sitting right here. And we're gonna go ahead and walk our fingers inwards towards the midline for about 2 inches, and we're gonna just rest our fingers there. So we're gonna go into the position first, which is lying down on our back with knees bent. And you can put a pillow behind your head if that's more comfortable for you. We're gonna go ahead and find the muscle first. Again, we're finding our pelvic bones, which is easier to find in this position. And we're gonna walk our fingers in about 2 inches, and we're just gonna rest our hands here. So from here, we're gonna go ahead and tighten or brace our core. And when you do that, you're gonna feel the muscles getting tight under your fingers. Pretend as if you're getting ready for a sucker punch. So I want you to think about bracing your core as if someone is about to punch you in the stomach. Or you can also pretend you have to go to the bathroom but you need to hold your pee in. First, just try to get the muscle activated, but when that becomes easier, you can actually work on holding that muscle contraction for a few seconds and then working your way up to 5 to 10 second holds. And when we're doing this exercise, make sure you're continuing to breathe, don't hold your breath. And also, we're keeping our lower back stable. You don't need to press it down, or just make sure you're not arching your back. You can do this 8 to 10 repetitions and several times a day. Another gentle exercise that I give to my patients is lower trunk rotation. It works on flexibility but also activating the core muscles. Before we start, we're gonna contract our TA muscle. Again, pretend as if you're trying to hold your pee in. After we activate the muscle, we're gonna go ahead and lower our legs to one side. Keep your feet on the floor. Once we feel a gentle stretch either on the side of the trunk or in your lower belly, we're gonna hold this position for 3 to 5 seconds. Make sure you're not feeling a lot of pulling, especially when your incision is still healing. After the 5 seconds, we're gonna go ahead and bring our legs to the opposite side. Make sure your core is still activated so you're not arching from your lower back. So our lower back is staying relatively still. You can repeat this 10 times on each side, so a total of 20, and you can do it 1 or 2 times a day. Next, we're going to do an isometric muscle contraction, meaning we're contracting the muscle without changing the length of it. After a surgery, there's usually a significant amount of muscle weakness, so I like to start with this type of strengthening because it tends to be easier and less painful. So we're starting in the same position. We're going to lay one leg down on the floor and bring the other one up to 90 degrees with knee bent to 90 degrees, so that way your knee is above your hip and shin relatively parallel to the floor. We're gonna go ahead and put one hand on our thigh. You can also use both hands, whatever is more comfortable for you. I'm gonna use one hand because that's just better for me. And we're gonna go ahead and push into our thigh with our hand. As you're pushing, you're gonna feel your TA muscle, which lies between our pelvic bones, contracting. This shouldn't be painful, so if you feel like there's a lot of resistance, just back off a little bit. You're in charge of the amount of resistance you're giving yourself. We're only pushing for 3 to 5 seconds, and then you're gonna go ahead and take a break. When you're resting, you can either keep your leg up in the air, or if that's more comfortable, you can bring it down to the floor and then repeat it. You can do 5 times on each side. Again, each time we're holding for 3 to 5 seconds. After you're done with one side, you can switch to the opposite side and do another 5. And you can do 2 sets on both sides with this exercise. Next, we're going to do supine marches, starting in the same position. First, we're going to contract our TA muscle. So again, pretend as if you're trying to hold your pee in, and you should feel the muscle activating right under your fingers. From here, keeping the lower back stable. So I'm gonna lift this up so you guys can see how I'm not moving from my back. So I'm contracting my muscle so it's able to keep my lower back stable throughout the exercise. From there, we're gonna go ahead and bring one leg up to 90 degrees. Again, knee bend to 90, so your shin is parallel to the floor, and bring it down, and then the other one. So we're alternating legs. As you can see, I'm not moving my lower back. Hopefully I'm not. But what you don't want to do is, which is a very common compensation, your lower back coming up as you bring your leg up. So just keep it stable. And you can do 5 lifts on both sides, doing 3 sets. Again, this should not be painful. You should be just feeling your core muscle working, which you're gonna feel right here. Next one is a stretching exercise for our belly. Before you do this exercise, make sure your incision is fully closed and healed. For this one, we're gonna actually lay on our stomach with hands by your side. We're gonna go ahead and push ourselves up using our arms. So try to keep your back muscles relaxed and stop when you feel a gentle stretch in your stomach, especially where the incision is. If it's too much, you can lower yourself down to the floor a little bit more. We'll hold this position for about 5 to 10 seconds, and we're gonna lower ourselves down, going back to the starting position. You can do this 3 to 5 times and several times a day. If you're not feeling any stretch in this position, You can go ahead and bend your knee, either one leg at a time, or you can do both if that's not too much for you. This is gonna give you a little bit more stretch. However, make sure you're not feeling any strain or pain over your lower back with this exercise. If you are feeling any discomfort in your lower back, you can go ahead and put a pillow under your belly. It should take some of that stress off of your lower back. Scar formation is a natural part of healing. However, if it's permanent, it can cause pain, swelling in the area, tightness, and sometimes it can even limit your mobility. For that reason, it's important to do scar tissue massage to break it down. So for the purpose of demonstration, I'm gonna draw my scar a little higher up in my belly, but if you have a DIEP flap, your incision is going to be a little lower, somewhere around here. Before you do scar tissue, your incision must be fully healed and closed, which takes at least 2 weeks. So just wait for that to happen before you even touch your incision. So there are different ways we can do this. The first one is parallel. We're gonna grab a lotion, anything non-scented should be fine, but first test it out on a different area just to make sure your skin is not reacting to it. So you're gonna grab lotion and we're gonna start on one end, going parallel to the scar. We're gonna go all the way to the other end, so we're working the entire length of the scar. You want to put moderate pressure because again, we're trying to break down the scar tissue, and light pressure is not going to be enough to break down that scar tissue. So we're going to go ahead and work parallel to the scar, going from one end to the other, so working the entire length of the scar. You can do this a few minutes. Another way is going perpendicular to the scar. So I like using two fingers for this, and you're using the pads of your fingers, not your nails. We're going up and down, going over the scar, again working the entire length from one end to the other. So if you're working on your DIEP flap incision, your area is going to be a little bit wider, going all the way from this hip to this hip. But you're working again perpendicular to the scar and applying moderate pressure. It might feel a little weird in the beginning because you're going to experience sensational changes because of surgery, but that feeling should improve as the scar tissue breaks down. And the third way is doing circles, again with two fingers, applying moderate pressure. We're going to just do circles instead of going perpendicular to the scar, so it's very similar to the second one in that sense. You can do scar tissue massage for a few minutes at a time, several times a day, but again, make sure your incision is fully healed and closed before you start it, because you don't want to interfere with the healing process. Other than that, that's it for this video. Thank you so much for watching. If you found it helpful, please share it with others so they can benefit from these exercises and information as well. And if you want to see more videos like this, don't forget to subscribe below. If you want to learn more about cancer rehab and lymphedema, you can find me on Instagram. The link is in the description box below. Thank you again, and I'll see you guys in a different video.